Flexible sigmoidoscopy is a safe and easy way to reduce bowel cancer mortality in people around the age of 55. The purpose of this video is to explain what will happen before, during and after the procedure to ensure that you are fully prepared and know what to expect when you come. Taking your enema. You should aim to take the enema 1 hour before you are due to leave to attend the hospital. When you're ready to take the enema, open the box to remove it. If you have any questions that the information you have been sent or this video does not answer, it may be helpful to read the information leaflet supplied with the enema. Place a towel on your bed and lie on your left-hand side, having taken down your undergarments, to allow you to place the enema nozzle in your back passage. Then, gently insert the nozzle into your back passage with a side-to-side wiggle. If needed, gently straining may help insertion. Once the nozzle is fully inserted, squeeze the enema tube to empty all of the contents into your back passage, and then gently remove the nozzle. Stay on your side for the next 10 minutes if you can. You can pull your clothes back up if you wish, or simply cover yourself with a towel. Once you have a strong urge to empty your bowels, you can then go to the toilet. Most people will only go once with the enema, but don't worry if you need to go more times. Occasionally, a bit of bleeding may be noticed from the insertion of the nozzle, especially if you have piles. This is nothing to worry about. Please remember to bring your consent form and invitation letter with you when you leave to come to the hospital. Finding the endoscopy unit. On arriving in the hospital grounds, park in any of the car parks. The endoscopy unit can be found easily on the ground floor of the hospital, but is probably best found from the main entrance. Head straight into the hospital, past Costa Coffee and Boots, and look for the large star on the floor. Turn left at this point, and the endoscopy unit can be found on the left-hand side of the corridor, 20 yards from the star. If you get lost, ask a volunteer for help, or look for the signs. Getting ready for the procedure. You will need to check in at reception and confirm your details and show your consent form. If your enema has not worked, please let the receptionist know. You will then be called by a nurse to show you where to get changed into your gown. The nurse will also take some simple details from you. A dressing gown may help you feel less embarrassed, so please bring one as well as a book to read.
Right, give you a couple of gowns. Back to pop your clothes in. Right, take a seat. Use one of the cubicles, and then when you finish getting changed, have a seat in the male area. Okay.
When it is time for your procedure, you will be taken through to the endoscopy room. Hello, come on in. Hi, I'm Dr. Goddard. The procedure itself. You will be asked to lie on your left-hand side on the couch. 2 nurses will be present in the room to help with the procedure and to look after you. After the endoscopist has passed a finger into your back passage to help lubricate the endoscope will be passed. This model shows you how the endoscope moves around the lower part of your large bowel. Carbon dioxide will be blown into the bowel to help the endoscopist to look for polyps and to pass the scope. You will probably be asked to change position during the procedure. This is normal and helps the endoscopist to get around your bowel. You should expect a windy discomfort and occasional cramping pains. If these are uncomfortable, you can have Entonox to help. About 1 in 5 people will have polyps, and if these are small and need removing, we will do this during the procedure. This should not be painful, but may prolong the procedure by a few minutes. If you have lots of polyps or a very large polyp, you will need another procedure to examine all of your bowel. We will tell you the result of your procedure there and then. If you haven't had any polyps removed, at the end of the procedure, you can walk out of the room and get changed again. You can then have a drink before leaving. If you have had lots of polyps removed, you may need to recover over the next half an hour or so on the trolley. Discharge and follow-up. You will be given a copy of your report, which will include the findings and follow-up plans. Most people will have a normal procedure or only a few small polyps and no follow-up will be necessary. About 1 in 20 will need a further procedure which will be explained to you before you leave. A letter will be sent to your GP explaining that you have had the screening and its outcome. A nurse will phone you the day afterwards if you have had a polyp removed to ensure that you remain well and understand your follow-up arrangements. If you have not had a polyp removed, we will give you a telephone number should you have any problems after the procedure. Hopefully, this video has helped you prepare for your procedure and answered any of the questions you may have about flexible sigmoidoscopy. We look forward to seeing you when you come, and if you have any more questions, please call the following number.